A patient named Drake, accompanied by his brother Drayton, is rushed to the emergency department by an ambulance because of acute symptoms from a community-acquired pneumonia. A registered nurse is at the ambulance entrance to receive them. Two emergency care staffs help get the wheeled stretcher off from the ambulance. They also hand over Drake's primary intake gathered during the ride. The nurse helps Drake transfer onto another stretcher provided by the emergency department. She then pushes the stretcher inside while Drayton follows alongside. The nurse pushes the stretcher into the triage room where a triage nurse receives Drake along with his primary intake record. The triage nurse asks Drake and Drayton questions regarding Drake's status of medication usage and brief medical history. She then checks Drake's vital signs, which include his heart rate, blood pressure, body temperature, pulse, etc. She determines Drake's triage level to be level 2. The nurse then pushes Drake out of the triage room toward the treatment area. At the same time, Drayton proceeds to the front desk for a registration, where he provides Drake's basic information and insurance, and receives a tag on his wrist. He then proceeds into the waiting room, where some walk-in patients and other family members are located. The nurse pushes the stretcher into a space in the treatment area and closes the curtain. Two other patients are waiting for their doctors in their spaces. The nurse double-checks Drake's primary intake and proceeds out to get the doctor. The doctor comes into the treatment area and starts to examine Drake's record. Drake expresses his concerns and demands. The doctor gives him a thorough examination at his stretcher and orders him a blood test and a radiography. The doctor leaves the treatment area while the nurse takes Drake's blood. She labels the blood samples and takes them with her while she pushes Drake to the radiology room. The radiographer receives Drake and the prescription from the nurse. The nurse then leaves to drop off the blood sample and the blood test order at the lab. At the same time, Drake is transferred from his stretcher onto the X-ray machine, where he gets his chest radiographs taken. Then the radiographer helps Drake transfer back onto his stretcher and calls for another nurse to come take him back into the treatment area, where he waits for his lab result, X-rays, and the doctor. Less than an hour later, the nurse brings back Drake's lab result and X-rays. She then proceeds to get the doctor to come evaluate the results. The doctor examines the lab result and the X-rays. He then decides to call a pulmonologist for further evaluation. The pulmonologist arrives in 10 minutes. He evaluates the results and discusses specific treatment plans. Then they decide that Drake needs inpatient treatment. The pulmonologist then leaves while the doctor instructs the nurse in writing down specific treatment plans for Drake. The doctor then leaves the treatment area while the nurse proceeds to help Drake get hospitalized.